In this video, I'm going to show you how to do an exercise that is very crucial for many of my patients for restoring full shoulder range of motion and for eliminating your shoulder pain. Do you guys feel something? Do you guys see anything? I'm Sam Schroetke, Doctor of Physical Therapy with Physical Therapy and Hand Clinic of Hillsboro, and in this video, I'm going to show you how to do an exercise called shoulder internal rotation. As I mentioned in the introduction, this is crucial for many people if they want to fully restore their range of motion and fully eliminate their shoulder pain. Some clues that shoulder internal rotation are going to be the correct exercise for you. 1, you do have some limitations in either this direction, which is flexion, or this direction, which is abduction. It either hurts at the end or maybe you're getting stuck. You might even have a little bit of pain during the motion. 2, you might also have some limited extension, right? So that's when we're reaching behind. This is my symptomatic side. Say my left side goes way back, but then I kind of get stuck here. That's a clue that this might be the right exercise for you. And reaching behind the back. Say my left goes way up here, and my right is kind of stuck down there. That's another clue that shoulder internal rotation might be right for you. And you've been doing shoulder extension, and either it didn't make you better, but it didn't make you worse, or it did make you better, but you plateaued. And you've tried the variations I've showed you in the other videos of shoulder extension, and it hasn't got you through that plateau. Or it helped a little bit, but then you get stuck again. That's the case, let's give shoulder internal rotation a try. Now, if your shoulder internal rotation is so limited and restricted and painful, I wouldn't do this exercise. So, if all the higher you can reach is here, and it's pretty darn painful, I wouldn't do this exercise yet. I'd stick with repeated shoulder extension. You've got to probably be able to at least get it to your belt line. If you can get it there, and you've already done repeated shoulder extension, and you've plateaued with it, then let's go here. Here I am. I can at least get my hand to the belt line. So that might be where you start. Just do that repeatedly. Make sure it doesn't make you worse. Eventually, you're going to plateau with that. You've got to get farther in the range. So what you might do then, hand to the belt, grab your wrist, and pull. Hand to the belt, grab your wrist, and pull. Hand to the belt, grab your wrist, and pull. Eventually, that's probably going to plateau for you. If not, if that makes you better, and it keeps making you better, and it gets rid of your pain, then by all means, stick to that version. However, if you plateau with that, we've got to progress. We've got to go farther into the range. Now we're progressing it to just reaching up behind the back as far as you can. Reaching up behind the back as far as you can. If that makes you better and gets rid of your pain and restores your full range of motion, stick with that. If not, we've got to go farther. We've got to add overpressure to that internal rotation. In order to add overpressure to internal rotation, you're going to need a belt or a towel. I prefer a belt. This is a yoga strap. Anything with a loop will do. If you don't have something with a loop, just hold on to a towel. But I do like the loop situation better because then you just slide your hand through and you don't have to grip anything. We're going to sling the belt over the opposite shoulder, slide our hand, the symptomatic side, through that loop, and here we are. The other hand is just going to pull down. Some people like to do this. I think that's more awkward. I like to do this. Another thing about this belt I like is there's less friction than when I use a towel, so it's easy just to slide up and down. This hand is pulling down like that. Pressure on, pressure off. Pressure on, pressure off. Pull, and then back. Pull, and then back. Pressure on, pressure off. Each time I'm trying to go farther into my range. If you're holding the belt way down here, that's all the higher you're going to get. You might have to choke up on that some. Right? So be choked up high enough on the belt where you can get to the end of your range. High as I can, a little overpressure, and release. I'm not forcing it. I'm not doing a real hard motion. I'm just trying to get it as far up my back as I can. Pressure on, pressure off. Pressure on, pressure off. When you first start doing shoulder internal rotation, it might feel uncomfortable and tight. As you go, it should start to feel better, looser. If as you do it, it's starting to feel stiffer, more restricted, and painful, then I'd probably back off. Go to one of the less intense versions of this exercise, or go back to repeated shoulder extension. When you get done with the exercise, test it out. If this had been painful or limited, or both, try it out. Does it feel better? If it does feel better, by all means, continue. If it feels worse, I'd go back to shoulder extension or one of the other shoulder exercises that I demonstrate on one of our other YouTube videos. I'm Sam Schroetke, Doctor of Physical Therapy with Physical Therapy and Hand Clinic of Hillsboro, showing you how to do repeated shoulder internal rotation. The dosing for repeated shoulder internal rotation is 10 to 15 reps every 3 to 4 hours. If you like what you've seen in this video, subscribe to our YouTube channel and click on the little bell. That way you're going to be notified each time we upload a new video showing you how to do one of these powerful exercises. Like the video, share the video with your friends, and leave comments below. Let us know if you've tried this exercise and how it worked for you. If it made you better, let us know that and say how. That way other people can get an idea of, wow, yes, this does work and I can get better. If it doesn't work for you, or if it makes you worse, let us know that as well. Because then we can suggest modifications to the exercise which might make it more beneficial to you, or we can suggest an exercise that might be more appropriate for you.